One of the cases that were a bit outstanding for me, it's one woman that came in. It was an intimate partner violence. This woman was a migrant. She didn't have anywhere to go, and worst of it, she didn't even have any documents. It was a bit of a dilemma even for us to say, then how do we go about with this case? I could not even sleep a bit because I was so worried. Seeing somebody in another foreign land with no one to talk to. So we had now to arrange the safety home where she was supposed to be kept in a safety space. We managed to be visiting her as sisters, as mothers, not even necessarily as healthcare providers.
From 2012, when I started working with MSF, I was working on HIV and TB program that is based at Ishowe. There was that mindset of looking at the migrants as the people who are coming to be a burden in our system, who also bring some criminality into the country.
Whilst we were doing the comprehensive care provision, we encountered that 40% of the clients that we were getting were migrants. I was also one of those that were very rigid when it comes to procedures and processes. But having worked in the space of MSF, that's when I realized that we need also to have the humanitarian aspect of doing things rather than just being rigid on the protocols.
We as a project try to bridge the gap and ensure as well that they gain access to services.
We have a hub in Tshwane and it gives them variety of services. It restores their dignity. They go out of the hub as different people who have dignity and are able to socialize with any other people.
I've always worked with stigmatized and marginalized people, but coming to MSF has just been a way for me to reaffirm my commitment to helping vulnerable people, because especially with migrants, their access and the consequences of their discrimination has a big impact on their mental health.
I've learned that working with migrants needs more than just the provision of medical care, but it needs the understanding of the circumstances that these people go through.
Working with MSF with the Migrant project gave me a different perspective on how to view migrant population. I've realized that for anyone else, getting access to healthcare, social services, and mental health services, it's a right. But with migrants, they believe that it's a privilege because they do not know and believe that they are entitled to the services.
Working for MSF teaches people to change their mindset and look at every person as a human being. We need to treat each other equally and then deal with everything thereafter.